Hi, everyone. My name is Marie Dreyer. I'm a third-year medical oncology fellow at Northwestern University in Chicago, Illinois. And today we're going to go over understanding acute leukemia, your guide to treatment and first hospital stay. My hope is that this video will reach patients and caregivers at the start of their journey with acute leukemia. And my hope also is that this can provide a sort of roadmap and framework, especially for that first hospitalization for patients first diagnosed with acute leukemia. This will be a bit of an outline of today's talk. So first we'll go into what exactly is acute leukemia and some of the biology behind the disease. And then the second part will very much be this roadmap that I hope can be helpful during your first hospitalization. I've kind of broken it down into three parts of the first hospitalization. That first part is the diagnostic process, getting lots of labs and blood tests and imaging to figure out what exact type of leukemia the patient has. And we'll go over what to expect in that process. The second part will be understanding what your treatment will be. That first treatment is termed induction chemotherapy, and we'll go over what to expect there. And then the kind of final part of the hospitalization is what we call kind of count recovery. We've really given you high intensity chemotherapy. We need to watch your blood counts recover appropriately. And that can come with also managing side effects, which we'll discuss. And then finally in this video, we'll talk about as we near hospital discharge and what life looks like after that first hospitalization. So first we'll start with what is leukemia? Well, it's a cancer of the blood and the bone marrow. Here we have a little visual of someone's bone and bone marrow. And that squishy part you might think about when you eat chicken wings. That squishy part of the bone is the bone marrow. And that's really the factory where your red blood cells, your white blood cells, and your platelets are formed and produced, and then they exit into the rest of your bloodstream. So leukemia is specifically when those blood cells are abnormal. Another couple of phrases that you probably will hear are AML and ALL. So AML describes acute myeloid leukemia, the M being myeloid, and ALL describes acute lymphoblastic leukemia, or ALL. And that really has to do with where exactly these abnormalities in your cells are occurring. What part of the growth process is abnormal? All blood cells, your red blood cells, your platelets, your white blood cells, start as a blood stem cell, and they kind of direct into either one of two families, the myeloid stem cell or the lymphoid stem cell. And then depending on where the abnormality in your disease occurs, will help classify you into one of these two types of leukemia. Now, there are subclasses to these types of leukemia and either other classifications of leukemia outside of this lineage, so to speak, but that's a little bit out of scope of today's presentation. So thinking about this is the way to classify big families of leukemia can be helpful when we think about your diagnosis. Now, no matter where the abnormality is, the myeloid stem cell or the lymphoid stem cell, those immature blood cells that aren't quite ready for prime time start to pack your bone marrow or that factory. It becomes very chaotic. And when there's an overflow of abnormal cells or overflow of blasts, that then creates a decreased amount of your normal blood cells. And that transfers into something we call cytopenias or low blood counts, leading to lower red blood cells, platelets, and low normal white blood cells. And understandably, that can kind of lead to some of the symptoms that are most common for patients to present with. So anemia, meaning low red blood cells, we can see that manifest as shortness of breath, weakness, becoming very pale, Thrombocytopenia is just a fancy word for low platelets. And platelets are the cells that kind of clump up and stop bleeding. So when those are low or abnormal, that can lead to excessive bleeding, bruising. Petechiae are kind of what we call small pinpoint bruises that you might see on the skin. And then neutropenia being that third cell count that can decrease, a specific type of white blood cell called neutrophils, which fights off infections and helps in wound healing. And oftentimes fever can accommodate this. These are common ways that patients present with leukemia, but in general, fatigue, weight loss can also be a part of this. Sometimes patients will have leukemia actually go into the dermis of their skin, and you can have invasive skin lesions present. Bone pain can be another symptom as we think about that bone marrow factory really overproducing abnormal cells. It's not abnormal to have bone pain. And then in some types of leukemia, patients can also present with gum swelling. So any patient can present uniquely. These are not ways that we necessarily diagnose patients. There's a myriad of lab testing that we'll go into, but this is major ways that patients can present. I think another big question that patients and their caregivers understandably ask, or what caused this leukemia? Why do I have leukemia? And I'll cut to the chase and say that about 70 to 80% of leukemias diagnosed, we just don't have a good answer yet to pinpoint the reasons. But other risk factors can include patients who have had prior chemotherapy or radiation treatments for separate types of cancers. That damaging of the cells that helps treat their prior cancer can sometimes lead to an increased risk of having leukemia or the abnormalities of the bone marrow and blood cells. We're learning more about environmental exposures, so different pesticides, solvents, exposure to radioactive waste without protection. We're learning more, but those certainly seem to be in play. And then often patients will ask, are my family members at risk for leukemia? Did I inherit this from someone? And while there are about 5% of patients, and while there are some hereditary and genetic syndromes that can be inherited through the family, those are on the lower, reasons for having leukemia, around 5 to 10%. You'll definitely be tested for certain syndromes while you're in the hospital through all of your diagnostics, but it's on the lower end of causes for leukemia.